Results from a new study may lead to approval of what could be the first drug to help kids with severe peanut allergies. Dr. Richard Chaffoo is here to explain more. Doc, good morning. Thanks for being here.
Raoul.
This is a much more serious problem than a lot of people may think, correct?
It is, Raoul. You know, it's unfortunately, but 1 in 50 children will have an allergy to peanuts, and these can be life-threatening. So it's literally, if you look at your classroom, you take your child to school, out of the maybe 2 classrooms, one of those children is going to have that kind of a problem.
Yeah, and we're talking life-threatening level, not just a little something that, my goodness. Okay, so let's talk about the new drug and what it consists of. Potentially, this could be a lifesaver and a life changer.
It could be both. In fact, what they found is they're actually using a defatted peanut flour, and they start out with a very low dose, about 3 milligrams a day for about 2 weeks, gradually increasing that dose. The study found that after 6 months of this treatment, you could subject the children in this study to a 300 milligram dose, which is equivalent to 1 peanut, and actually 2/3 of those could tolerate 2 peanuts or 600 milligrams. Now, it's not a cure. We're not going to have somebody can't start having a peanut butter and jelly sandwich.
Right.
But what it does do is prevent someone from getting a severe reaction to eating something that contains a peanut that we didn't know it was in the food in the first place.
If you take that and you can withstand 1 peanut,
yes.
A lot of times when there's a mistake at school with lunches or something like that, that's all it takes.
Yes, exactly.
It could save a life. Any other treatment on the horizon?
So there is actually now another immunotherapy that the FDA has gotten approval, they've submitted for. This actually a skin patch, so it would be something that you would wear long term.
Wow. New concerns, we've talked about this on the show, about sesame seeds allergies.
So sesame seeds are actually probably the 9th most common allergen out there. Probably 300,000 people will have some reaction to sesame seed. And the problem is it's in a lot of products that aren't labeled. They might, things like tahini or natural food products, in fact, have sesame seeds in them, and they can also be life-threatening like peanut allergies.
Is it just people don't know because it's number 9 on the list, and maybe most people don't know
about it? Not so aware of it. So there, the number of allergies that we have, so instead of being the top 8, it'd be number 9, but certainly milk, eggs, fish, shellfish.
Yeah, all of these are the allergens that potentially could be big problems.
Yes,
for people,
exactly.
Right? As we go through this list, I mean, is there advice? Some people are, well, we can't change everything. I mean, how do you adjust so that we don't hurt other people, essentially, not intentionally?
Well, that's a great point. I mean, I think the important thing is if your child has an allergy, be an advocate. Make sure that your child is not going to get exposed to this in a school environment and food environment. And if they're going to go out to a party, make sure you know where they're going and alert the parents that there is a significant allergy to a certain food.
I tell you what, this is why we have doctors. This is why this guy is so important. There was another story we talked about where sucking on your infant's pacifier could protect against these allergens. How does that work?
It's fascinating because it's thought that the mother sucking or spit cleaning the pacifier actually stimulates the body immune system because it actually allows the child to get exposed to germs, if you will.
Right.
And they found in that group of children that their levels of IgE were actually reduced, and IgE we know is elevated in asthma and allergies. So the theory being that the more we expose a child to, whether it could be a pacifier or it could be maybe the house isn't clean quite as well.
Right.
The child's allowed to play in dirt.
I was going to bring up playing in dirt because your natural instinct is you want to keep everything clean around the baby, but actually benefit to the long-term health.
You may be keeping them in a bubble, and so
you don't want that.
You don't want that. Some small exposure actually may help to mature the immune system, so they're less likely to develop these allergies later on in life.
Fascinating stuff, Dr. Chaffoo. As always, we thank you
for
your expertise. Okay, let's get you outside now with Jolla.